Good afternoon, everyone, and thank you for joining us. Welcome to the very first PHN Talk series. We're glad to have you. Um, my name is Olabisi Dabiri. The vision of the PHN Talk series is to learn and share ideas on the issues, health issues in Nigeria, and come up with possible solutions to those issues. We hope to invite people from different aspects, different sectors, from the private sector, the public sector, government, academia, to discuss pertinent issues in health and possible solutions to those issues. The topic of our discussion today is partnerships in health, and I have with me Dr. Muntaka Umar Sadiq, the CEO of Private Sector Health Alliance of Nigeria. So over the past couple of weeks, we did some crowdsourcing for questions and got some feedback on those questions. And there are quite a lot of people eager to hear from you. So over the course of this program, I'll be asking you some of those questions. If you have any comments or questions, please feel free to put it in the chat box beside your screen, and I'll ask them as we go along. So to start off, please could you tell us a bit about the Private Sector Health Alliance of Nigeria?
Thank you very much for the opportunity to share and give some color about what it is that we're trying to do as a basis to accelerate improvement in health outcomes in Nigeria, and also sort of showcasing the importance of partnerships to advance health outcomes. I think, to your point, this dialogue series is really timely and extremely relevant. Particularly from sort of the policymakers and private sector lens. So thank you very much for this initiative. To answer your question, the Private Sector Health Alliance is a private sector led coalition led by corporate and private sector leaders in Nigeria, including the likes of Alhaji Aliko Dangote, Mr. Jim Ovia, Mr. Aikin Okwede, Mrs. Shola David Bora, Mrs. Saraki, and other private sector leaders, and it seeks to really sort of bring together the collective private sector across a coordinated platform to leverage the private sector's collective capabilities, resources, expertise, innovation to complement government's efforts in accelerating improvement in health outcomes through sort of innovation and partnerships. I think that till recently, private sector engagement in health has been really fragmented and uncoordinated. And so the Alliance really presents a compelling platform to pool private sector resources, assets, and capabilities and have impact at scale that is larger than the underlying sort of corporate initiatives that we see, particularly within the context of increasing interest from entrepreneurs and philanthropists to do more.
You made some comment about the sector being fragmented. For some of our viewers who don't know about the health sector in Nigeria, could you give a bit of an overview highlighting the role of the private sector in the health sector?
Sure. I think I'll do a couple of things. First, give, if you like, that broad landscape as to where we are in terms of performance. Okay. But secondly, talk from a very granular lens as to why our mothers and children are dying from very preventable causes. And perhaps lastly, we'll talk about the structure of the health system itself, public versus private, and the opportunities that we have to go a lot faster in terms of results. So I think, well, first is that we, of course, have a very heterogeneous and complex and dynamic health system in Nigeria. It is laden with both supply as well as demand side challenges. But from and so in a sense, the state of the health sector is characterized by suboptimal maternal, neonatal, and child health outcomes, poor quality of care both in public and private facilities, but also a double disease burden, right? So we continue to have persistent vaccine preventable and communicable diseases, but also have growing burden of non-communicable diseases as a result of sort of lifestyle changes and an aging population. In addition, the insufficient protection from financial risk as a result of the cost of healthcare is a major concern. You know that our health insurance coverage, very, very low across population groups. But also, if you look at the structure of our health system, we have a very dominant private sector, right? So the private sector plays an important role in financing and delivering care. And when I say private sector, I mean everything from your private health sector in terms of private facilities, PPMVs, and informal private sector, but also your business community, the industries, your telcos, financial institutions, and health SMEs who actually have capabilities and resources and expertise that can benefit our health system. So a recognition that we have a mixed healthcare system really allows us to, if you like, re-examine or rethink the way we actually engage the health system from a purely kind of public sector lens to one that incorporates private sector capabilities, right? So if you like, this model of public-private coalition. And I think this is, if you like, the theory of change that has seen the emergence of the Private Sector Health Alliance.
Okay, so could you just recap on the 3 points you made?
So the 3 points?
Yeah.
Around what?
Around the overview, highlighting the overview of the structure. So you mentioned the landscape. The second one was the...
Okay, so for the second piece, I'll just add a bit more color around that, because it is estimated that we lose nearly 1 million women and children every year from preventable causes. More people die in the country, but in terms of preventable causes, I mean diseases as malaria, diarrhea, diphtheria, now polio. 50% of our under fives die as a result of malnutrition-related deaths, right? And so having that paradigm shift to focus on saving lives and our bold aspirations to sort of support governments in its quest to save 1 million lives every year speaks to this, right? In particular around sort of the basic services. I would also add in terms of the third point around harnessing the distinct assets and capabilities of the private sector. First, there are significant innovative advances that we're seeing in the private sector that we can, of course, leverage or transfer for the health system. But also, there are various techniques. We can solve our biggest health challenges through business techniques, whether it's performance management, innovative financing models, social marketing capabilities, and many other models.
So, what are some of the barriers you can see that would prevent private sector organizations from engaging in the health sector?
Sure. Well, I think in my mind, there are several market failures that impede private sector engagement in the health sector. All right. I think there are about 4 archetypes that I'd like to discuss. I think the first is what I mentioned earlier, which is around the fragmentation. We have a very fragmented sort of private sector with thousands of small clinics and sole proprietorships, right? And so this inefficient market structure does not allow for at-scale interaction between the purchasers and providers of care, right? So if you imagine, even if Bill and Melinda Gates Foundation wants to, provide vaccine services to private facilities, where does it start, right? Because there are too many small independent proprietorships. So the transaction cost to engage is a significant issue. So the fragmentation is one big thing. And I think in that area, the Private Sector Health Alliance is working with a number of states to begin to defragment the private health sector. So we are creating, if you like, institutions of scale, private provider networks, about 8 private provider networks to address this market failure, ensure that we streamline the variability in terms of quality of care, enhance the financial management capabilities, and begin to move towards shared services. And I think that's sort of the first time we're seeing this model in the country. In addition, we're also seeing sort of what we're calling quality improvement maternal and neonatal collaboratives, right? And this is over 80 facilities across a number of states. Same thing, it's really to address this market failure and extract synergies in outcomes and results. So that's sort of the first important barrier. I think the second is, what we hear all the time, which education, agriculture, constraints both on the supply and the demand side in terms of health financing. So if you think about the providers, your clinics, they're great clinicians, but they do not necessarily have the financial management systems or capabilities and business capabilities to apply for a loan, for example. That capacity issue is significant. But on the flip side, institutions do not necessarily have the filing or abilities to invest in providers. They understand, for example, the oil and gas market and other traditional markets, but the health sector is in which clearly capacity needs to be wrapped up in that area. And I think linked to that, and this really from a macro perspective, is the high cost of capital. Given the macroeconomic realities today, the interest rates and the cost of capital to get a loan is significant. So all of this really creates an inherent constraint in terms of capital that we need in the private health sector to scale and increase access to services, particularly for the poor and underserved. I think around this area, there are a number of interventions that the Alliance has really begun to drive. One is really this Healthcare Leadership Academy, which really is a partnership of, I would say, non-traditional partners.
Why would you say that?
Because we are seeing the emergence of complementary partnerships that are focused on innovation. One of the co-founders of the GQA now leads the NCDC, and many other actors, the Chigari Foundation, for example. So we're seeing partners really bring to bear innovative advances in the health sector. The Health Leadership Academy really focuses on the mission of healthcare leaders in governance, management, and leadership. And so financial management capabilities that contribute to this market failures. This academy creates that in-country platform, and many cycles of different kinds of programs have been rolled out to target some of these frontline health workers. And we're excited to the point where we are sort of using this platform, private sector management techniques, private sector leadership techniques from performance management, quality improvement, financial management, bringing in the likes of Cambridge University, Duke University, to curricular, effective model. And we're sort of scaling this up. So we're very excited about this. In addition, we have financial institutions that are members of the Alliance, also bringing to bear some of their, if you like, innovabilities and fiduciary risk management systems to address this access to capital issue. We're also sort of engaged in the CBN in innovative financing, sort of similar to what we have seen in agriculture, to begin to facilitate, if you like, impact investments in the health sector that will benefit the underserved, or at least that will reduce the high hurdle rates that we're seeing in the health sector. So that's sort of the second. The third is the issue around asymmetry of information, particularly around coordination and alignment. We have a engagement with the public sector, and we're not seeing the sort of ongoing dialogue with the public sector that is sort of there is scope to better organize our private providers. So limited mechanisms to actually engage the public sector. By that I mean things like we don't necessarily have a framework for contracting services or social marketing. And I think that is why the Alliance has this kind of membership model, bringing together different kinds of private sector across one platform, have better coordination and alignment, and have the opportunity in outcomes. We also do sort of our annual summits and engage sort of directly with the public sector to address this constraint. And I think as a final tariffs, multiple taxations that really affect the inputs in the health sector, right? Your drugs, your medical equipment. Policies do not really foster the kind of growth and development that is required in the private sector. Enforcement of standards is also optimal. And more importantly, there is a distortion, because of the constraints in policy and regulation. There's sort of a distortion that informs patient choice, investment considerations, and quality assurance. And so you kind of have as competitive as it should. So I will sort of stop there for now, but I think that the alliance was predominantly set up to address all of these market failures, and I've sort of given examples as to how there's sort of a very deliberate strategy by the alliance to harness our capabilities and address these market failures.
Thank you very much for the explanation. Another question we got, one of the most popular questions, where do you see the biggest opportunities, partnership opportunities in the health sector?
Okay, I think wow, that's a good question. Thank
you very much, viewer, for sending in that question.
I think that to answer that question, I sort of need to, I guess, take a step back.
Okay.
And speak a bit about where I think we are, right? Okay. I think that as a country, we are at an inflection point where 4 transitions are happening at the same time, so simultaneously, which is what is unique about this current period, and why I think we're talking about partnerships today. The first is that we are currently undergoing a political transition, right? So we've transitioned from one party to another. We have a new crop of leaders. Implications, particularly around governance structures, but also the fiscal space that we have for health, right? So if you recall, years ago, we had the economic management team where the Ministry of Health sat side by side with the Ministry of, Planning and Finance. Yes. And so the engagement and intersectoral collaboration that you need to build a case for financing for vaccines, or anti-immunization or polio could happen somewhat more organically. So you can see how the political economy that you have has a significant role to play in terms of unlocking the kind of financing that you need to advance the health sector. So I think that political transition and how it looks at investments in human capital development versus, say, infrastructure and the priority setting is very important. So that's the first transition. The second transition in my mind is a macroeconomic transition, right? So there are new realities in terms of FX, what dollar is today. Yeah. We're currently going through a recession, and so that would certainly inform economic transition is key. The third is an epidemiological transition, right? Our population continues to grow. We have a very strong and vibrant population, and the manner in which we invest in unlocking that demographic dividend will either be a curse or blessing for our health sector. I think the next transition is an epidemiological transition, which is sort of the transition from focusing not only on communicable diseases, malaria, TB, AIDS, to your non-communicable diseases as well, right? So your diabetes, your cancers, and all of that. And I think the last transition is the MDGs to SDGs transition. Yeah. And so this grand convergence of these multiple transitions creates a compelling opportunity for us to distill lessons from the MDGs experience, restock, shape our aspirations, and do something bold and disruptive for the health system to actually advance health outcomes. Now, to do that, we need to focus on disruptive innovations, and we need to bring together partnerships. And this is why we're here today. Yes. So having said that, I think for me, when you look at our health system, right, and a number of areas where I see priorities in terms of partnerships. The first is around health system strengthening. All right, so there are opportunities to leverage private sector capabilities, whether it's supply chain capabilities, whether it's governance and accountability, and that is very important. But also, and more importantly, is disease surveillance and epidemic preparedness and response. There are opportunities to leverage kind of private sector technology and innovation for detection, prevention, care, and response. And we're already beginning to see clarity and coherence in terms of what the NCDC is doing around that area. And so this the nexus of disease surveillance, epidemic preparedness, and response, I think, is an area where the private sector can bring to bear a lot to help the health sector. I mean, during the times of Ebola, you may recall that the Alliance convened the Ebola Roundtable,
Yes.
where the likes of telco partners were able to support the health system with contract tracing and demand creation capabilities. We had oil and gas companies help and FMCG companies help with some of the logistics needs. We had the likes of Dangote Foundation mobilize resources to invest in some of the human resource for health support required, not just in the country, but across the region, right? We also had the opportunity to transfer, some business and private sector techniques, the Ebola Emergency Operating Center, right? So using data and performance management to track results. And so you see how partnerships at multiple levels, not just public and private, but also federal and states, state and citizens, local government as well, but also the government and traditional institutions, right? Because we know that traditional institutions have the sorts of followership, at the community level that sometimes has a big impact when it comes to addressing demand side and awareness issues. And this is why the likes of Chigari Foundation, playing a very important role in engaging traditional institutions and community structures to advance health outcomes. And I say this because we don't want to wait for the resurgence of another outbreak or epidemic to do this. Yes. So this is an important area that I think that we need to secure the commitments now to prevent resurgence in the future. And the Alliance is currently mobilizing those sorts of partnerships to ensure that happens. So I think, we can't talk about disease surveillance without putting it or situating it within the context of a strengthened health system, right? And so this is why I put it under that bucket: disease surveillance, governance and accountability, the capacity. And so the work we're doing with the Healthcare Leadership Academy to transfer those management and business and quality improvement techniques is really important. So I think that's one big piece systems. The second for me in terms of by the public sector, but 2/3 of facilities at the secondary level owned by the private sector, right? And the service delivery in Nigeria, over 60% is by the private sector. So we know that there are significant service delivery points, or if you like, retail outlets that are owned by the private sector that must be harnessed to have the kinds of access, particularly to the vulnerable and poor, that is required to make all of the difference. So the private sector to enhance service delivery and scale up the coverage of various interventions, maternal and child health, the MTCT, nutrition, I think is critical. So partnerships, whether through public-private partnerships within this area, I think will be significant. So that's, for me, the second big important aspect. And that's why a lot of the work that we're doing in terms of innovations in service delivery is critical. I think the third, financing and impact investments, right? I think that there's a unique opportunity to utilize the excess financing or capacity that is in the private sector. We know that every year in Nigeria, we lose nearly $1 billion on medical tourism. So there's a unique opportunity to invest in country to stem the tide of that outbound medical as well. And so there's a clear case for transitioning from philanthropy to more strategic or impact investments. And so this is why we are sort of mobilizing resources from the private sector to deploy capital in a manner that has catalytic impact. And so financing is critical in that area, because look at the country's strategic health development plan. Malaria, for example, there's a significant financing gap. In partnership with many over 15 private sector companies, we are leading a movement towards sort of a malaria to zero campaign, mobilizing resources that target issues, right? Because we cannot, if you look at over the last decade, we've seen significant investments in malaria, but we've not seen commensurate results in terms of outcomes, right? So we cannot continue doing the same things and expect different results. So there's a need to sort of rethink approach and target the sorts of interventions, right, that will truly disrupts this poor cycle of health system performance. So that's sort of the third one. I think another important area is around advocacy, meaning there's an opportunity to sort of put the voices of the private sector to engage government around evidence-based approaches and state scorecards that drive interventions and action. So I think that's sort of another big area in terms of partnerships. There are a few others, but I think as we sort of look to the future, those are sort of the areas that, at least as an alliance, we're pretty excited to support governments in advancing some results going forward.
So you mentioned need for private sectors to join, organizations to join in advocacy with the government. What are some of the tools you use in those type of engagements?
I think that from a personal perspective, you cannot improve what you can't measure.
Yes.
Right? And one of the biggest barriers that we have in the health system here is really limited data reporting, and indeed the quality of data. So that continues to be a constraint. And so as we Saving 1 Million Lives initiative, one of the important things that we did was a dogged focus on data and results, right? And so we have scorecards, Saving 1 Million Lives scorecards. And what we do there is that we have the leading causes of morbidity and mortality, right? And through population-based surveys and health management information, collect data based on the coverage rates of the interventions. We're able to estimate the number of lives saved. So for every dollar that I get from a CEO of a private sector member, I can report how many lives saved, right? Because what we want is that other sectors, Ministry of Finance, if you ask them about their biggest achievement, they will talk to you about number of jobs created or contribution to GDP, for example. Or Ministry of Works will talk to you about number of kilometers of roads built. But in the health sector, we were not necessarily framed in a manner to talk about results in that way. And that is why this currency of performance, number of lives saved, is sort of an important results. And the genius in it is that it re-engineers the health system to begin to spur out, so strengthening the data collection systems, increasing the reporting rates of HMIS, and more importantly, it's one thing, the data, but what's more important is the demand of that data, right? So we have, I engage various state governors to look at the scorecards to inform, right? So you collect data. There's no point collecting data if there isn't demand for it and it's not being utilized for corrective action. So a lot of our advocacy is really around those mechanisms to utilize data and set targets and achieve results. And I have to talk about the pioneering role of HSDF in that in that regard. And so the partnerships that we have, collecting data on the one hand, but also using with state governors, both at the at the subnational, but also at the federal level, to achieve results, I think is critical, and I think represents one of the most exciting things that we have to strengthen accountability and the next few years.
I know PHN does some work around innovation, and a few years ago you had the Health Innovation Challenge. So how has PHN been able to use private sector engagement in health innovation?
I think if you, for us, innovation is at the heart of what we do, right? Because I mentioned earlier that current health programs are clearly inadequate and need to kind of drive private-driven innovation and disruptive approaches to actually move the needle. That's sort of why we're here. If you look at many other African countries that have been able to meet their health goals, they've been able to do that by creating and accelerating innovations to sort of achieve scale and markets. There was sort of limited traction driving technology and innovation in healthcare delivery in Nigeria. So for us, it was important to create that convergence platform to begin to identify, incubate, spur promising innovations that would tackle health system challenges and accelerate improvement in health outcomes. So we have registered over 400 health innovations, incubated about 42 innovations during sort of a boot camp, an incubation boot camp. We have invested in a number of those through a performance-based approach. 12 innovators are currently going through an accelerator program where bridge financing will be provided to support scale-up. So this is sort of the first platform of its kind in Nigeria that is mobilizing towards health and innovation. In addition, we are providing both market and technical linkages, right, to link our innovators with us. We're providing the community of practices that is required, identify the priorities. We have a unique public-private partnership where the government defines the problem statements and the private sector health alliance creates a platform for innovators, businesses, individuals to come together and provide the biggest solutions to our priority healthcare challenges. And this is why we're very sort of excited about this. And even as we speak about the partnership priorities for the future, we mentioned disease surveillance. I believe that some of the innovators from our pipeline will be best positioned to, bring solutions to some of these big challenges.
Okay, and then would you like to speak a bit about the HIDAP, the Health Innovation Development Accelerator Program?
Sure. For the current accelerator program, we have academic institutions. We have pooled mentors from the private sector, Coca-Cola, Etisalat, Dangote Group, PNG, and several others, connecting them to our underlying innovators who need various kinds of capacity needs. In addition, we are strengthening their business and financial management capabilities. A lot more context around what it means to achieve scale in the health sector, right? They're businessmen and do not necessarily have the capacity around the health sector. So providing that context has, I think, been incredibly important. And I think another important piece is also the knowledge products and sort of framing their businesses in a manner that will have not just commercial returns, but also social impact. And so that blend and of core competencies to make money and save lives is what we're sort of driving in the health sector. We want to lead that paradigm shift in the health sector from being an economic drag to one that is a net contributor of economic growth and job creation. Yeah. And I think that what the health innovation marketplace is beginning to do is sort of lead that charge. And I'm kind of excited by some of the we're seeing. We're at a point where we're sort of wrapping up the accelerator program, and the second cycle of new innovation challenges next year will come online. So we're incredibly excited about that.
So we've spoken about the opportunities, we've spoken about the structure of the health sector, we've spoken about the barriers, the big barriers. So where do you see the future of the health sector in Nigeria?
Well, I wish I could see the future, but what I will say is that and from where I sit, there are a few things that are emerging. And I think first is, we've spoken a lot about saving 1 million lives, X amount of people die, but there are faces behind the numbers. These are real children in Borno, real women in Enugu. So for me, I see a future where at the heart of health systems interventions will be these beneficiaries, right? And the role of innovation and technology to empower and educate these beneficiaries, such that we have a situation in the future where our consumers of healthcare become a lot more empowered and more educated. What that will do is that there will sort of be a cascade effect, right, in terms of accountability, in terms of improving quality. So that role of technology and innovation, our patients or beneficiaries become active users of healthcare, I think will disrupt things. Everyone has access to the sort of education required to better manage their care. So I think we will see. I think there's something there. So I think that's one, which is sort of the role of innovation and technology to empower consumers. And I think second, and accountability. I think second is the transition from communicable to non-communicable diseases, right? I think we will begin to see the searchlight switch a lot more.
Because there isn't a lot of information in that regard.
Absolutely. So if you look at the online prevalence data that you need for NCDs, I think they're not there. Yeah. So I think the future we will see a lot more attention there, particularly as it's growing very rapidly as well. And I think that data around that area is significantly underreported. So it's potentially a hidden time bomb.
Okay.
And for that, everything from the screening, early detection, and all that will become a lot more important. So I think there is something around that epidemiological transition. But also, I think that on the supply side, will be I'm CEO of the Alliance. I think 50% of people who come and speak to me are investors looking to invest in the health sector in Nigeria and across other markets. Yeah. So I know that given the macroeconomic landscape, the significant pressure, consolidation and integration, right? Streamlining businesses, cost models, pricing regimes and things like that. So we're going to see consolidation across the chain, right? To sort of see a lot of that, and that will have implications as to how investment capital is deployed. I think another big thing for the future, I think, will be this universal coverage agenda. Okay. I think that's clearly the biggest buzz at the moment. For me, it's as a kind of private sector platform, is that with increasing consensus around universal health coverage, there will inevitably be better public sector financing to achieve that, right? And so once that happens, I think it will help to, if you like, health markets, right? Because private providers will need to position accordingly to, contracting services to achieve that and things like that. And on the flip side, regulators and government will have to be better stewards of health markets as a result. So I think that sort of additional public financing that will come to achieve universal health coverage will mean private sector providers and expertise required for better allocative efficiency, sector expertise for better and more cost-effective delivery mechanisms, private sector innovation to help streamline businesses, and the health core will sort of be required. So I'm sort of excited about what we're sort of seeing in that area and how the Alliance is positioning for that transition.
Okay, well, thank you for your response. So we're in the era of the Sustainable Development Goals. We're done with the MDGs now, but we have to look at sort of the lessons learned from the MDGs experience. So what would you say are the most learned from the MDGs experience, and how would that help to achieve the universal health coverage agenda you mentioned earlier?
I think that there are a number of fundamental lessons from the MDGs experience. I think it's important to establish that there is clearly an unfinished agenda in terms of the MDGs, before talking about SDGs. But I think lesson for me is really around the fact that concrete action only often happens when there's a strong political and social movement behind it. And the leadership and commitment at the federal and state level in sustaining and achieving universal health coverage. Right? So leadership and governance are literally at the heart of doing this. And you can see why. So in Nigeria, the Fiscal Base for Health, the National Health Act, it's the right leaders across various levels that are required to actually go from from policy, from vision to real execution, which is required. Healthcare fund, do we have the mechanisms for that? Like, who is thinking about delivery and execution? So I think the second is around quick wins and early results. I think we've seen the importance of going from inputs to focusing on results and outcomes. So to your point around the data systems to be able to track and measure progress. We also know you often need early results and quick wins to cure the sorts of supports that you need for public sector reforms. And I can give an example there. Under the leadership of Dr. Mohammed Ali Pate a few years ago, 1 million lives initiative. And I remember clearly when we were at 30,000 lives. But today we can look back at and say that over the last few years, 1 million lives was saved, right? But it starts with those early quick wins to do additional advocacy and secure the kinds of partnerships that you need to scale, right? And today, the Federal Ministry of Health and the World Bank, have deployed $500 million towards the Save Women Lives, so it's institutionalized and scaled up. But it all started with early, quick results. And so focusing on ways of verifying results is really important to sort of secure the sorts of support and partnerships that you need for scale. And I also have to sort of commend, the leadership of the Ministry of Health and World Bank for, recognizing that and sort of institutionalizing and supporting that scale up. So that's second. I think the third aspect for me is the importance of health systems, but more meaning investing in a resilient health system that improves access and manages costs, I think is kind of another important lesson. There is also a big, I think, service delivery lesson because it's relatively context specific, right? So you think of in countries, the importance of lower households has become, in fact, in my mind, they represent the backbone of the primary healthcare system to service delivery and sort of task shifting methodologies. I think key in that era. And I think that the last piece is, for me, more a multi-sectoral integration. Going beyond investments in health, right, and recognizing that education, hygiene, water plays a very important role in that regard, but also things like social safety nets, which I think the government is currently doing to address some of the poverty and cycle, poor maternal and child health outcomes that we're seeing is also key. To address that, we need very deliberate policy interventions that will ensure that we reduce the disparities in terms of, but also redistribute resources in a manner that mitigates inequities in access and care. So I think those are kind of the big lessons for me as one. We must continue to focus on completing that unfinished MDGs agenda, and that means focusing on mobilizing the private sector towards basic services, supporting government towards basic services, scaling up vaccine, immunization coverage, maternal and child health, and all of that. Basic services to the nooks and crannies of the country. That's one. The second, and as we think about universal health coverage, I think it's around prevention agenda, right? I think there's been a lot of focus on building hospitals, cures, treatments, but I think there's a huge space around agenda, around the prevention agenda. Particularly, there are certain bills, tobacco bills, mental health bills that can help to significantly reduce that burden. Focusing on some of the important risk factors, lifestyle measures, diet, and things like that. I think that has a huge place, particularly as we know that non-communicable diseases is a time bomb for the future. So we need to begin to focus on that. I think the third aspect for me is the black box issues, right? And those are things that people don't necessarily talk about, but play an important role in the management of care. So things like quality improvement and quality assurance, things like performance management and data systems. And so for us, that clinical governance, performance management and quality improvement, I think will be an important area for us to help achieve the SDGs. And I think the last piece is around the private sector, meaning unlocking the market potential of the private sector and helping to, across the three affirmation things, address demand side financing issues that would enable us, go faster and accelerate improvements to achieving the health-related SDGs.
Well, thank you so much for joining us today and for answering all our questions. Thank you all so much for joining us as well, and thank you for the questions sent in. Please follow us on all our social media platforms on Facebook, Twitter, Instagram, and Google+. Our ID on all accounts is at PHN_Alliance. That's at PHN_Alliance. And if you would like to watch this video again, it's available on our YouTube channel, Private Sector Health Alliance of Nigeria. Thank you all so much again for joining us, and we'll see you next month. Our theme for next month is innovation, so we'll be excited to see you all again and with the new speaker for the day. All right, thank you so much.
Thanks.